bone spur that I'm removing on a patient. She had trauma to it when she was younger. She's had it for a long time, and the procedure is pretty simple. It's called a bone spur exostosis through trauma. I've taken a lot of these off. They're pretty simple to take off. It's not near a blood vessel, so we don't have to worry about any type of, and I can already feel it with the blade. But you really don't have to worry about it losing any, basically cutting a blood vessel or anything like that. It's pretty simple surgery. I'm already down to bone. And basically I just open this up. So now we're past the skin, now we're past the subcutaneous tissue. So now I'm actually visualizing the bone. I'm not even close to any vital structures. I kind of like removing these. I think they're kind of fun. It's a, I don't know, I guess I'd call it a Mickey Mouse surgery, but it's a minimally invasive surgery. But she has it on her medial cuneiform, first metatarsal. It was a jamming where the bone was jammed. See, I can see it right here, and it's pretty obvious. But I'll take this off, and little retractor here. You can just see it right there. It's not huge, but I guarantee it with shoe gear. I'm sure it is pretty painful. But basically, I'm just taking off the subcutaneous tissue right here, and I'll take my little dental burr and rongeur it off, flush it out, and then close it. That's, I wish I could act like it was more complicated, but it's really not. So, put this in. It's called an arm retractor. I have several of these in my packs, and you just open them up like this. So you can look in there, you can visualize that. But that's the huge spur right there. So, pretty obvious. Okay. So now you just take this little rongeur on this side. Not having any pain, are you?
No.
Yeah, you won't. Good. Just take the little rongeur and take it out just like that. Pretty simple. Already halfway through. Little big old piece in the back. Got to take it off. Miss that spot. Look at that big old just taking it out. Woo! that thing's big. It is big, isn't it? Or big enough. It's like a tooth, you know. Like extracting a tooth. Man, that thing is pretty big. I'll show the patient. The tooth. Go. That was about half of it. Now I got the big bulk out. Now I just need to take the, yeah, I got a little one right in there. Big old bony spot. Done. Now I'll just kind of smooth it down a little bit. Move it. She walks out the door. See, I just go in like that. See how I'm saving it all? Wonderful. It's excellent. See, it's smooth. You can tell it's smooth as glass now. That's a little ragged part right here. That looks good. Good. Excellent. There. Can't feel anything, which is good. Can't feel anything. That's what I want. Okay, now just suture it back up and she's done. Probably put in one little subcutaneous stitch, and then after that she's take the tourniquet down, put on the shoe. Technically she can go back to work. I don't see why not. It's pretty simple. Simple, super simple. That's the way I like it too. And one like that. This have a little what we call subcutaneous stitch. I'll put in one right here. There's no reason to put in them. These are what we call absorbable sutures. They 180 days they'll dissolve and they're done. It's fun. I guess it's fun. I guess if you've done a lot of them, it's not so fun, but I still like it.
To know more about bone spur removal, go to HomeRemedies9.com or subscribe our channel.